Hi everyone, welcome back to my channel. Welcome back to Nurse Katherine here. Before we get this video started, don't forget to hit that subscribe button below and give this video a big thumbs up. So, in today's video, I am talking about my new job. I am absolutely loving my new job. As you guys know, I am no longer a bedside nurse. I am no longer being a reactive kind of nurse. I'm being more of a proactive medicine kind of nurse. So, what does my work day look like? So that's what I am talking about in today's video. I am talking about my new job as a transplant clinic nurse. I have a lot of information to share with you guys, and I'm really excited to share with you about my job and about my coworkers and just what I'm doing on a day-to-day basis. I just got off work. As you can see, my hair is up in my little bun pigtails. So let's get this video started, and I can't wait to tell you all about my new job. So first, let's talk about patient populations. So who am I even taking care of in a transplant clinic? I never even heard of a transplant clinic until starting this job. Actually, until I applied for this job, I didn't know a transplant clinic was a thing. So patient population are people who have already gotten transplants or who want to be placed on a transplant list. Secondly, what kind of transplant patients? I'm doing kidney now, but I will be also taking care of liver patients, heart transplants. So kidney, liver, lung, heart. I think that might be it. I think that's all the kinds of transplant patients I'm taking care of. All right, so what do I do on a daily basis? Like, what does a transplant clinic nurse do? So there is this really fancy medication. It's pronounced DELL for short. Here's a picture of what the box looks like. That is the medication that I am giving to probably on average about 20 patients a day. Sometimes it's less, sometimes it's more. So I am giving this as an infusion, so it's kind of like an infusion center. So I could be certified if I want to as an infusion nurse. So I'm giving this DELL medication instead of these patients getting Prograf, the anti-rejection medication. So these patients come in on average about once a month to get this medication rather than Prograf. And what I have learned so far in my whole 2 weeks of learning is that Prograf causes more long-term side effects internally, and DELL does not, and that's why they recommend DELL to some patients, most patients, and I believe it's only kidney transplant patients. Don't quote me on that, but of what I know as of right now, that's what it looks like. It's just kidney transplant patients getting this, not other transplant patients. So I'm giving DELL at the other facility or clinic, transplant clinic, and coming over to ours eventually in the next few months as we are growing and getting back to normal numbers, since COVID really depleted that. I will be getting into iron infusions, blood transfusions. I do not believe we will be doing chemotherapy, but I'm not exactly sure what the next couple months is going to look like. So that is a part of my day, is administering this medication to patients. It takes 30 minutes to infuse. So these patients are literally in, I stick them with the IV. I get blood draws if need be. They get blood taken every 3 months. And then I hang their DELL and they're out the door. That's it. I have these patients for about 40 minutes, 45 minutes, depending on how long it takes to get their IV site. Then I also have patients who are being consulted to the doctors in our clinic. So I learned that these consultations might happen if their kidneys are rejecting, or if they are waiting to get on the transplant list. They come in for consultations and I do all the consultation charting. Other than that, those are the two kinds of patients I have seen so far. Now, when going back to the Bella patients, the ones getting the Bella medication, I am able to administer that through an IV that I put in when they come in. I also will be learning how to access ports. I also will be learning how to access grafts and fistulas to take blood from those areas, but also administer the Bella medication through those areas as well. Next, let's go to my schedule, and that is 7:30 to 4 p.m. Monday through Friday, no holidays, no weekends. It feels amazing, guys. It feels so good to be able to do something on the day that I'm working. Like, right now I'm going to the gym, and then I go to work, and then I come home and I can cook, and I can go on a walk with my husband, and I can do all this stuff with my husband that I couldn't do on the days that I'm working. I am not emotionally exhausted anymore. I'm not mentally exhausted. I still am trying to get over the fact of not doing bedside nursing, but I am extremely happy that I made the transition. I could not be happier. It is definitely a transition that is like weighing your pros and your cons. Like, I don't have all the experience that I'm getting from the ER, well, especially ER when you're coming from ER nursing. So I'm not having all of that skill set, but I have a whole different kind of skill set now. So it's very different mentally, and I think I really was talking with my husband about this. I was putting my self-identity, I guess you can say, in my job and ER nursing, which is not right, because I need to find my identity in Christ first and being a Christian. So I really struggled with that. I still am kind of struggling with leaving the ER and just the craziness of the ER, which I loved, but at the same time, I kind of always felt like my license was on the line as well, just because of how chaotic it was getting and how short-staffed it was getting. And I didn't really enjoy it because I didn't like the fact of being too task-oriented anymore. I just did not like that. So now I actually get to talk with my patients, and I feel like I can connect with them and hear their stories. And yes, it may be a bit more slow-paced kind of, but it's still actually really busy because you only have these patients for 45 minutes and you have to kind of do a lot in 45 minutes. And you have multiple patients coming in all at once. So it's very interesting. I don't know, I'm kind of all over the place, and I said I wasn't gonna make this video long, but it's kind of getting long. So that's kind of what my week has looked like. I have helped update the staffing board. I'm helping getting ready for JCO. I am helping with like getting shipments in and doing the store, like the stocking room, and just organizing things and just kind of figuring out how the clinic works, because there's only 3 nurses who work in the clinic. There's 3 RNs, 2 LPNs, so 5 nurses total. We have our nurse manager, who's a registered nurse, of course, and then we have no PCAs, CNAs, nothing like that. We have people up at the clinic desk who are taking in the walk-ins, not walk-ins, but the patients coming in. And then that's it. And then we have our doctors and nurse practitioners. And that's all I'm working with in a day. But it's really nice because you really get to know people well. And my coworkers are absolutely amazing. I love my manager, and it's just a really great situation. And I don't know if I've ever smiled like this about a job before. I just absolutely love the other side of nursing. And it's so nice to be with patients doing the more proactive kind of nursing rather than reactive kind of nursing. The mentality of the patient is different, and I really enjoy the proactive mentality of patients rather than the reactive. That's just how my style is, and I really like proactive medicine rather than reactive medicine, and this feels very proactive. So yeah, that's kind of what my week is like. I still don't know everything and what it all entails. There's some paperwork that also goes with it, but really not a lot of paperwork. But that's about it really for now. I am collecting like urine samples, blood samples, yeah, and that's it, guys. That's all I'm doing. But it actually is a lot in the day. The day goes fast. It's nice. I'm not like paper pushing. I'm on my feet. I'm not just sitting behind a desk. I actually get to use my nursing skills. So don't think outpatient nursing is just like hey, let me sit back, kick my feet up, this is an easy peasy job, because it's not easy, but it's not crazy, and you don't have to feel like you're gonna lose your nursing license every day you go into work. That's how I was feeling. So guys, that is it for today's video. Sorry, I just ramble on. I think you guys probably already know that by now, but that is it for today's video. Thank you for tuning in. I will come out with another update eventually about my job once I learn more about my job. But thank you for tuning in. Make sure to hit that subscribe button, and I will see you in the next video.